I think perhaps the most obvious and dramatic shift that we've witnessed over just the last 3 to 4 weeks has been the shift to remote care. We're all used to having video conference calls now. For healthcare, that's something that's by and large been most unusual. In fact, in many countries around the world, there are legislation restrictions in place that limit what sort of patient consultation interaction you can have online. And whereas many people now are used to managing their bank account, their day-to-day living through an app on the phone, healthcare is something that's been very resistant to that. We've seen a dramatic shift in 3 weeks. Some people are talking about as much of a 10 years change in healthcare delivered in just 3 weeks, as face-to-face contact has been very severely limited, both because of a very contagious infection, but also because of travel restrictions that have been put in place. And so naturally, many people have reached to teleconferencing facilities, to mobile phones, and just as straightforward telephone consultations to be able to manage patients remotely in a way that we haven't managed to achieve in many, many years. This digital transformation of healthcare is very timely. Healthcare has been very late to come to this, but I think many are now hoping that this is one change that's going to be here to stay. This is not saying that all healthcare is going to be delivered through a mobile phone in future. It most certainly is not. But I'm hearing estimates when coronavirus is over that perhaps 30 to 40% of healthcare practitioner interactions could transition to being virtual consultations in future. To be absolutely clear, coronavirus, all the data so far indicates that it's significantly worse in terms of outcome than influenza. Mortality, death is not the only outcome. And as cases are progressing, we're increasingly seeing damage done to kidneys and other organs as well. Although it's early to say, it's quite likely that we will start to see a number of other longer-term medical problems arising from coronavirus sustained from other organ damage. So death is not the only outcome, but it is a very binary outcome. Typically, over the course of most pandemics, the mortality rate will drop over time because it's a function of how many people have been diagnosed. And there is plenty of evidence to suggest that there are asymptomatic carriers, people who are infected, who perhaps don't even realize it. And they will need to be tested and recognised in order to get an overall picture of what the mortality rate is for the disease. But I think even at this stage, it's very clear to see that the outcomes are much worse. And part of that is also related to the transmissibility. It is a very contagious disease that is already established as well. And the more people that it infects, the more risk there is of it overwhelming the health system, as we've already seen in many other countries, particularly in Italy and Spain in recent weeks. And that in turn has a knock-on effect as well, because hospitals that are overrun and are unable to deal with the surge in patients in front of them, that impacts other patients with other medical conditions as well. And it's quite likely, as we study the data over time, we will see an impact on patient illness and potentially also death from patients from other conditions who didn't present to hospital, perhaps because they were worried about coronavirus. They didn't seek emergency care when they should have done, or they delayed seeking care. And so they will present at a later stage when they're worse. And it's important to recognise the impact of that on health and well-being as well. And that is an indirect consequence of coronavirus. One way that we will perhaps look at this in time is that actually I think the efforts and work of many health systems, given the constraints that they are facing, be that workforce, be that funding, it's remarkable that they've been able to adapt and pivot so quickly to deal with an absolutely unprecedented challenge to them. There is no doubt that lessons are going to be learned from this. Last year, Johns Hopkins published the first ever global ranking of health system security, looking at different countries' abilities to prepare and deal with pandemics. And one of the key findings from that report was that there was no single health system anywhere that was truly fully prepared to be able to deal with a pandemic. Every country that they ranked had opportunities for improvement. And I think there will be an important period of reflection when this initial first wave is over. There is likely now to be a much greater emphasis on our ability to deal with future pandemics. I think we have to remember that with the exception of SARS and swine flu, most of what we're seeing now has been within the realm of fantasy and fiction and Hollywood movies. And while with the benefit of hindsight, is a wonderful thing to be able to say how health systems might have better prepared. I think it's only going to be in the cold light of day after this when that we're able to learn the lessons and truly strengthen health systems to be able to deal with this in future.